from the fact that a number of wards are still closed. And the problems continued. In November, there was flooding in the hospital. Joining me now is Professor Adam Mahomed, Head of Internal Medicine at Charlotte Maxeke. Prof, thank you so much for your time. I mean, it's just been a litany of disasters, and I know I haven't mentioned all the problems that has beset the hospital since that fire. What is the current status of Charlotte Maxeke Hospital?
So we are currently running at less than 60% capacity. Our outpatient service around 40%. We've lost around 250 beds and numerous ICUs that have been lost and not been activated from April to now. And the amount of rehabilitation work to the part of the building that was damaged by the fire is in the region of 0%. And the rest of the hospital is going under rehabilitation for City of Johannesburg fire regulations. So essentially, we are functioning with one arm tied, one leg cut off, and one eye missing. And we are expected...
Continue.
We are expected to offer a service, and you did say we are one of the largest hospitals in Gauteng. It's actually one of the largest tertiary quaternary hospitals in southern Africa, linked to Chris Hani Baragwanath, Grooterskloof, and Tygerberg. And the services we render are unique and cannot be replaced by district and regional hospitals.
I mean, it's astonishing that you're saying you just feel that you have not enough has been done to bring back this incredibly important hospital to full functioning, less than 60% capacity. Talk to me about the patients that are being affected. We've heard a lot about the oncology patients. What is the situation for someone who's diagnosed with cancer and comes to Charlotte Maxeke for treatment?
So I'm going to use a practical example, and this was aired on lots of medias. Someone comes and has breast cancer and is treated with chemo. We are currently restricting our patients into the oncology service because of COVID, social regulations, and numbers of beds. So you have to wait a little bit longer than what was normal to get chemotherapy. You get chemotherapy, and then you have a window of opportunity for radiotherapy. Then we have radiotherapy where we have inadequate human resources, inadequate machinery to give you radiotherapy in appropriate time. So you wait, and a curable cancer becomes incurable and comes back again. So we've given you a death sentence by us not doing anything. And this is not only about oncology. You have a cardiothoracic surgical unit that is not functioning properly, and patients are waiting on the list. And we're not talking about adults. We're talking about the most vulnerable patients, pediatrics, children, are not getting timeous cardiac interventions. And what happens? The longer you wait, the worse the outcomes are, and people die. And this goes across every single subspecialty in internal medicine, in surgery, in gynae oncology, in pediatrics. We are in a state of chaos, and there's a lack of sense of urgency and need of what we're doing. And my heart goes out to the 40 healthcare beds for mental health care users that we've lost. In a province which had life isidimeni, the sense of rectifying the injustice of mental health care use, optimizing their care, is not going and is not being heard. And people are getting suboptimal care because we're burdening other hospitals that were already overwhelmed. Southern Gauteng healthcare structure needs help.
You wrote, I think it was in December, an open letter to President Ramaphosa outlining just how desperately difficult it's been for you and your colleagues. And you've written, the national government continues to pour billions of rands into other state-owned enterprises. We beg you to please help salvage ours. Have you had a response from the president?
Nothing has come directly to me or to any of the meetings I've attended to, and I'm actively involved in a lot of the meetings. What has happened, there is a slight change in mindset for getting public to get involved into fixing up this hospital. But it's not about the public. This is the responsibility of the government to fix up this hospital, and the public can chip in to support and maintain and encourage. But it's not the responsibility of private donors to build a hospital. It is the responsibility by the Constitution for citizens to have decent health care. We are not fulfilling the rights of the Constitution and the Bill of Human Rights. And everyone is quiet about the violation of human rights. And I'm sorry to say this, what we are doing is a violation of the most vulnerable people in this country, in Gauteng. And something has to be done. Public Protector hasn't come back after coming to visit us one year. Human Rights Commission, quiet. Where's the noise? Where's the fighting for the justice of what has happened?
Why is this not being treated as a matter of urgency? I mean, what you're telling me is utterly appalling.
We had leaks this week in our hospital from poor maintenance, pipes being blocked. Things are not being fixed up because we have a hospital that's over 30 years old. And if you don't maintain a hospital, things like this will happen. And this fire and COVID has brought out the limitations in what we are having. And Department of Infrastructure and Development, Department of Health, and all the entities, we should get together and come up with a solution. The argument of we don't have money is not good enough for me. All the money we're recovering from corruption, take that money and put it into this hospital. Let's put the money where it needs to be. So all the cases we're getting from tender fraud, take that money and put it immediately into CMJH so we can get back to treating patients and giving patients the best care possible.
Thank you so much for talking to us this evening. This is a crucially important issue, and I really hope that things change urgently. Professor Adam Mahomed, Head of Internal Medicine at Charlotte Maxeke Hospital. Still a desperate situation there.